Thank you for coming for CFS. I'm Oliver, and this is Adi, our clinical specialist. Yeah. So today we're going to start with like the APP pad, which is the alternating pressure pad. So overall, the height is 3.5 inches high, and then the pump weight capacity overall is like 220 pounds. Yeah. So this 3.5 inches is only for the overlay on top of the regular mattress system. So there will be two flaps, one in the top part, one in the bottom part. So you're able to secure this pad, not moving around, even though the patient, it could be wobbling sometimes, but the pad will be staying in place for the flap on it. Because like the settings is very simple and very straightforward. Using the two tubing hose connecting to the pump, and then you set up the weight for the patient that way. And how the pad working is like, there will be two holes, so there will be A. So you see right now all the inflate one is the A cell, and then there's also the B cell will be deflated. So there will be a 15-minute cycle time for A cell and B cell to do the alternating, preventing any pressure ulcer occur. Because overall, it's just like the common part, how the pressure ulcer occur is just like stay on the flat hard surface, maybe on the mattresses, but the patient immobile, so they're not able to move around. So that will be the part that after 3 to 6 hours, then will be something like the skin will turn to regular color to purple. Yeah, so that's the part that basically the one for prevention that pressure ulcer occur, this will be the best one to start. And then right now it comes with like the regular commercial boxes. So there will be instruction on the top over here, how to set it up, connecting the pump to the pad, and then to put on the mattresses, and then before that, set it on the patient that way. So overall, the warranty on this one is a year. So they either can exchange the pad by itself or the pump. So that's overall for the Thomas One pad overlay system that we have. Okay.
Question, Oliver.
Yes.
On that, do you have to, is that for most people who like have some type of ailment going on, or is it for anybody who just wants something where they can kind of, feel good or get that flow at nighttime, especially like menopause and you have neuropathy issues and things of that nature? Not that you're bed bound, but just that flow in the middle of the night.
Yes, that's more suitable for that, because like, overall it's just like patient probably not able to move themselves, then this will prevent them like the surface of the skin attached with the bed too long. So that's the part just preventing it occur.
Yeah, also keeping in mind that this is basically a prevention type mattress system, so it comes in the like kind of clinical conditions that you talked about already. So it comes in providing that comfort and alternating basic therapy just for patients like those. So definitely any prevention, giving comfort or those clinical benefit at a basic level, this overlay pad will like come handy with that, those kind of patients. Yes.
Awesome, thank you.
Questions?
I have a question. Is that the only size it come in? Can you get it like in a queen size, or is it just for the hospital bed only?
Usually for like the twin size bed, you're able to fit it in, but not like the bariatric more than like 42 or 48 is not able to fit it in. So far we only have standard 36-inch wide. Yeah, and the length is 80-inch. Yeah. Also
for the bigger sizes, bariatric, as the bed capacity is increased, we recommend more of like mattresses which have like cell height more than 3.5, so it can work better. Yeah.
So does it also work on the twin extra long?
Twin extra long, yes. The extra long, yes, because like the stay in place pad, the flap over here, you're able to extend it. Because like this, right now this is the only 80-inch long on the mattress beneath it. So you see there's more space over here and the top part to justify the length. Yeah.
Now, is it fully inflated?
Right now it's fully inflated. Yes. Because like, we're using the quick inflator to just like buy out time and try this. Yeah. But majority it will take around like 30 minutes to be fully inflated. to place the patient on top of it.
Yes.
Yeah.
And then is there like a certain like you have to set it for every 30 minutes,
Oh,
60? Is
so
it
this
automatic?
one is automatically. Only
Okay.
like 15 minutes will alternate by itself.
Okay.
Because like, there's only one mode. It's just like alternate mode. And then it's just like there's an on-off switch over here. Setting out the weight is using the dial. Okay.
So should it be fully inflated before the person gets in?
Yes.
Okay. And it's about 30 minutes.
About 30 minutes. Yes.
And then really the only thing you have to input is the weight.
Yes. That's the only settings you can change
To do.
on.
Okay.
Yes.
Does it work with adjustable beds?
It works with the adjustable beds. This one right now, if we wanna adjustable beds, meaning like the
Yeah, I have
at
an
the
adjustable
head.
bed
Uh-huh.
where I can adjust my head or my.
Oh, okay. There'll be the settings, follow positions, and all those for the legs. Yes.
This is the leg, and this is the head. Because as long as the mattresses
And the flaps are
attached-
inside. You'll be
Yeah.
able to like move the bed,
Move the
change the
bed.
positions for different kinds. Yes.
Yes.
So I like that kind.
so you can see it. But this one, the mattress beneath it, we already
Fix
kinda
it. Connected
locked
it with the
already.
Yeah.
So it might not move, but like the regular foam mattresses, it would not move around at all. Yeah, as long as the patient is on top of it with the pressure, the weight on it,
Yeah.
so it will be staying put.
So is the mattress, when you lie on the mattress, is it kind of sort of massaging you, or what is it?
So basically what it's doing is like relieving pressures from the pressure points. So like for example, for the first 15 minutes, you can see like, let's assume these are the A cells. So it will like kind of like just like keep the lower the pressure from here, but the other B cells will have the highest pressure. So it's kind of relieving those pressure points from your skin after every 15 minutes, and it goes on like to cell by cell segments. So that's how it's like kind of like relieving those pressure points, helping in improving the blood flow, and helping like kind of maintaining the proper skin conditions.
Got it.
Yeah.
And is there a return policy?
Return policy, you probably can discuss it with your CFS medical. Yes. Overall, this is about like the dumbest one. Yeah, the ABB PAD system that we have.
Now, is it only one?
Right now, we can jump to the different
The
systems.
second system.
Yes. Good question. Maybe on top of this.
I have a question. How long has this been on the market?
This one been in the market for, you can move over here. Right now the pump is still pumping the air in. Once it reaches to the max firm level, it will automatically jump to alternating. Okay, right now it's just maybe in the initial setting, I can walk you through. It's just like put the mattress on top of it. We lock it with 6 different rings on each of the corner to make sure like the mattress will stay in place. And over here, connecting with the cable management ring over here, make sure like the wire, the power cord not gonna strip anybody to falling down. Okay. And this mattress system, what we display right now, demonstrating is for the Domus 4, which is a cell-on-cell design for home use, for long-term care facility or skilled nursing facility to use it on. So the reason why skilled nursing facility or the home care we recommend this to use is because like it's a cell-on-cell design. The meaning of cell-on-cell is like you can imagine there's a cell on top of one air cell. The upper air cell will releasing the air, so it will constantly releasing the air, and the bottom air cell will contain the air up to 6 hours. So if any power outages, you don't need to worry that you have to scramble to moving the patient. Sometimes for the emergency, it will, the mattress will secure the patient up to 6 hours. Yeah, to keep it not like right on like the mattress's frame that way. Let me lower it down a little bit. Could you check if it's...
After 6 hours, will it just inflate?
Yeah, will be still inflate. Yeah. So after 6 hours, it will kind of deflate. Yes.
Now, is this made only for the hospital frame?
Yes. Because like this is slightly, you need to able to lock it with the rings over here. So if you use a regular home use bed, you probably don't have the
bars to like fix
the
like,
bars
put
to
the
lock it that
things in.
way. Yeah.
Just to give you like a quick information on the clinical side of the bed, it comes with like multiple therapy modes. So basic like the alternate therapy, it comes with A and B cells, which is like pressure point releasing therapy. It also comes with the static mode, in which like each cells of the bed will release, deflate like a little bit of air, so that like there is a body like kind of like embedded, and like there's proper like pressure like kind of point of like going all over the bed, basically. And also it comes with a micro lower loss. Basically that's for the microclimate management, because like the patient's skin can be sweaty and all those things, which can make like the skin like have ulcers, or can promote like kind of like increase like the chances of getting one.
Also like the side rails too. Side rails sometimes happen when they moving the patient, but when they raising up the head part, and then it will release the protect as well. So those are the common issue that the facility, like the home use, will face. Yeah. So we just tuck it in.
Okay, so what's the purpose of those?
Those are the purpose to moving the patient for and when they are doing CPR.
CPR mode, yeah.
Yeah, because the CPR, if you do it on top of the mattress, you probably not will be efficient until like all the hard surface for the patient to doing the CPR.
There's a certain amount of pressure that's needed, and with the mattress inflated, they cannot put that much amount of pressure to reinstate like the heart, or if there's a cardiac arrest, or like things like that, basically, for example. So for that easy deflation of mattress, we have like 2 CPR like pull tags. For each,
So
like,
it deflates the mattress?
Yes.
Deflate the whole mattress. Yeah. So right now, Mike gonna able to override it until like once you wanna open up, it's just the same way, 3 seconds, then we'll be able to override to the different mode. And another part, when they moving the patient out to the different transfer mode, right? So sometimes you need to, over here, remove it and lock it right away. So you're able to move the patient with the mattresses to the other bed or the other room too. Yeah.
And the mattress will stay the same?
The mattress will stay the same. Yeah, because like it's only probably
It
like
retains
3
the air for,
seconds.
like,
Yeah.
6 hours.
Yeah.
And then you have to transfer that to the other bed you moved into?
Yeah. Another like I guess Oliver can mention in detail. As you can see, it's very easy to clean as well. It's connected to this pins over here, so like you can see each cells can be easily seen, housing can be easily seen. It's easy to clean basically, and also like replacement can be done for each cell. It's easily removable as well.
Yeah. Each of the air
Yeah.
cell.
And how often should a person clean it? And how often should it clean it?
Well, I would say it depends upon like patient condition, but like I guess if it's going to facility, the CMS have their own guidelines on cleaning the mattress on a regular basis, because they document it. So it's highly recommended that they like check it like like bi-weekly, weekly basis, depending on the patient condition, to see if the mattress is clean and it's like kind of disinfected and all those things. Yes.
And the cells are individual?
Cells are individual, and there will be like two part of it. So you'll see the upper part. There's one outlet over here, and the bottom
And the
part.
lower part will have another hosing over here.
That's why, because it's cell-on-cell design, so you were able to see. Maybe let's remove it.
Yeah.
Yeah.
as you can see, two housing. One will retain the air in the lower cell. One is basically providing all the therapy modes for the patient, like taking control of inflation and deflation of air, basically.
And the rest of the cells are still inflated?
Yes,
Yes.
the rest of the cell will be still inflated.
You can see it's easily removable on the other side. Each cell is replaceable, it's cost effective, so it's really a good part.
So we can wait until it's not gonna make the sound right away, but normally it takes like 3 minutes. Yeah.
Now, does a message come up to let you know whether or not a cell is not working?
Yes. Yeah, because like the pump will sense, because like we put it back too soon, but just like normally, yeah, there will be a sound come
It's
on.
like audible and visual alarms.
Yeah. So to mute it, it's just like sit and pressing it, and it will be muted that way. Yeah. So the other part, just like the top cover, is also replaceable that you can probably order from CFS for any replacement cover. Yeah. And then it's washable. The washing instruction is showing on the very lowest part of it. Yeah. So you're able to know how to wash it. The washing instructions on top of it here. Yeah.
Is it hand washable or is it machine washable?
Machine washable.
That's
Yes.
good.
Hi.
Hi.
You're good. I'm sorry.
So far, you guys have any questions on
questions?
them? No. Okay. So is this the common one that you guys use in the facility right now, or is like home use?
I don't have any. I'm thinking about the oak light.
Okay.
And I'm just impressed that it's so quiet. I mean,
Yes.
there's certain sounds that people don't like. It
Yes.
just reminds them of the hospital.
Yes.
So that was the only thing, it was the beep, but that is understandable because it wasn't working. But I'm super impressed how quiet it is.
Yeah, because like those two are the most recommended one for like the entry level for prevention part, and then that's why the noise level will keep it as quiet for home use as well. Because like you definitely probably gonna bother like the family members in the next room. So.
And for all the, we do have a specific sales kit as well, which we will be providing to the CFS with detailed instructions, and like if you want to like go over like things or videos or functionality of mattress again and again, although we are available like basically, and they can set up a meeting again for like specific products to train you again. But yeah, we do have all the details that we'll be providing it to them. It contains disinfection recommendations only by FDA, but I guess you guys already know about like most part of those things. But just to go through it, like, you know, what's the standard right now out there, and to like refresh on that, we'll be providing those materials as well. Yeah.
6, 42, and 48. And the difference compared to the previous Domus 4, the main difference is on the cycle time. You can choose that to do 5 minutes, 10 minutes, 15 minutes, up to 25 minutes for like the cycle time for the patients. Yeah. And like Adi mentioned earlier about like the top cover options, besides the regular coated cover that we provide in the default, there's a stretchable cover for it for the 4-way stretch, which I don't have right now. But also like there's the side bolster for like the 42 inches or 48 inches wide as well. And then the most different part is just like the CPR that we have over here. There will be 2, and then using like the knob type.
It's 2.
The knob type basically is like for the bariatric type of patient, like the side rails is a lot limitation for like the facility to use it on. So we're using like the knob type to be more secure. Yeah.
and that's the function. It's more secure basically compared to like pull tag. So
Yeah. Maybe open up the. Let's move back. Before like the mattress fully inflate, for the Serene ED mattress system, we have some special like for the heel relief function. So let me. So the heel relief function is basically over here. You'll see some clip that you can press it in, and then you can release the air like that. Because it depends on the patient's the length where their heel lands on, so you can totally deflate like the upper air cell. So because like the heel is the most common part that the pressure also occur, so that's the part that we have like the heel relief function for like the Serene ED series.
it basically helps in like it will like float. So like these are floating with zero pressure. Comes in handy like patients which are like diabetic, because most prominence is in their heels and lower proximities. So that's why like the heel relief function comes really handy for those kind of patients.
Now this mattress is wider than the bed frame.
Yes, because we happen to grab the 42 inches wide mattress. You have
Okay.
a good eye. Good
Okay.
catch. Good catch.
So this is bariatric.
Yeah.
And you can see the bariatric as well.
Yeah. So you also can tell it's much wider for like the twin size or like full size beds. So, almost there.
Yeah. So like two sets.
Does the second mattress do the same thing as far as the heel is concerned?
No.
No.
Only we have it for Serene ED series. We're good.
On the pump, you can see the max firm light on. So it will sense and the light will be on until it's max firm, and this light will go away and it will move to the therapy mode once the mattress is fully inflated, basically. So it will take some time because you won't be able to use any of the therapy mode until it's max firm and this light goes away and moves towards this side. That's why we recommend, like, you know, move the patient, wait for the light to go away, and then you transfer the patient on the pressure mattress systems. It comes with the same modes, just to like kind of like reinforce what we did with Dumas 4. So static, alternate, seat inflate. Alternate and seat inflate can be like kind of like their combination, so they can work together. So the patient has the therapy and more comfort while he's in a forward position, or like, you know, head side of the bed is raised. So that's what we have in the modes over here. As Oliver mentioned, we have like the cycle time. So it's more customizable for how much cycle, like, you know, you want to provide for like alternating or something like that, 5, 10, 15, 20, working on that ways. And it does come with, as you can see, one pump can go with the 3 sizes of mattress. So it mentions different weights depending on what kind of mattress, what size of the mattress that you're using. I think this one is basically 42. So the weight setting for this one will be around 650 pounds. And this is basically a comfort setting. As you can see, it's a digital like pump. So depending on like where the patient feels comfortable, you can like change the weight settings from over here. Comes with like it also, like this LCD where you can see the cycle time, it will also show you the error codes, and you can refer it back to your manuals to see what error is there, and you will be able to know what problem the mattress is having. Sometimes it's like 01, which is like for like air leakage in the mattress system. It does have like error code, or like it will come up with also like, as you can see, sorry to like come back to it, it's max and fade, and it just moved to the therapy mode over here, which is static by itself. Now you can like just change to any therapy modes, like I did alternating, and you can change the cycle time from here once it's done. And then you can see the static and seat and fade both can work together in this one. And then we have like low pressure, if there's any low pressure air leakage. Now for example, there is like CPR mode, you didn't like turn it back or like kind of like tighten it, it will show low pressure. So these are some of the basic things you need to go through when you see the low pressure alarm. Check the CPR, check the check the air cells, check the hosing connecting to the palm. These are most general like issues which come up when it comes to like, you know, mattress losing the air. Other than that, there's power failure mode as well. If there's power is on, there is no power. If the pump is having issues with power, the power failure mode light will go up, and they are like, you know, maintenance light as well. If there's a need of change in filter and all those stuff, there will be like, you know, kind of like, you know, maintenance light will go up. So these are like kind of like things telling you about troubleshooting over here. These are both all audible and visuals. That's pretty much about the pump, other than the locking system, which is similar to like Dumas 4. 3 seconds you have to like press this for that time. It will like lock or unlock, either way. What's the setting is that for the
Is that user friendly?
It's pretty user friendly, yeah.
Yeah.
Because the only part is just like probably you need to wear glasses to see the digital, the numbers correctly or not. That's all.
Yeah, it might sound a lot, but like, you know, once you are like kind of like knowledgeable for the pump, it usually will use like basic setting criteria. You go to alternate, you will just the cycle time. The weight you have already like kind of fixed it, so you're basically moving like, you know, the therapy modes most of the time and cycle time. You're working between these two things apart from anything else. Yeah, so it's pretty user friendly.
So the weight right now for the 42 inches is able to cover up to 1,000 pounds. So that's the part difference than like the Domus 4 what we explained earlier for 450, because like this one pump able to fit in 3 different sides of the mattress system. So earlier we did kind of address about like the CPR using the valve type and the specialty of the heel relief function. So that is the standout part between like the Domus 4 and the Serene Elite. Yeah, because overall the therapy mode is still is the same until you're looking for like the the bilateral mattress system,
yes,
like turning mattress system that we do have, but we didn't bring it over here. But it's just like this Domus 4 and Serene Elite able to cover majority of the population for the patient to use it on for prevention purposes. Yeah. Because like the most common one, if they happen to looking for like the therapy type of air mattress system, we do have it. But that one will be the Serene Air, which is in the catalog. Yeah, that one able to produce like 1,300 minutes per liter, which is these two. As you can tell, like it's so much quiet. This is only like producing 25 minutes per liter of air from like the air cell. Yeah.
So we basically call it like true low air loss therapy because that's using a blower pump. So it's like kind of pushing a tremendous amount of air in the mattress system, and it has very effective low air loss system, which like the air coming out of the cell, the amount is really high. So like it's more effective when like patient have like you know treatment of like multiple pressure injury, basically like, you know, have like stage 1, stage 2, stage 3, or like multiple stage 2 kind of pressure injury patients. So that can be used for that. Any questions?
Good. So the other part, just like regular maintenance part, is just like there will be the filter on this side that you need to just like kind of change it, because sometimes it's definitely gonna, because this pump will suck in the air in, so there will be a pretty dusty. So you just need to clean it every week, just like wash it and just like dry it out and put it back in like that. Yeah.
What's the lifespan on one of those pumps?
The life, we cover up to 2 years, but a lot of like the dealer been using it more than 5 years, still working. Yeah. because like the all the parts, I say the faceplate, because like sometimes you have to imagine the nurses, everything what they're setting is in a rush, so they press it so hard, right? So this definitely the faceplate is gonna be ruined apart. So this is able to be replaced as well, and inside like the blower, the timing motor, and some power module is all replaceable as well. So if you happen or work for our warranty, then we can like kind of train you guys, or we can like fix it for you too. Yeah. So the washing instructions we mentioned earlier.
Yeah.
So
similar than that.
yeah. So this is about the Serene Elite.
I have a question. If you get up in the morning and you set the settings for it, would you have to do it every morning, or will it stay there until you change it? Or
Yeah, it will stay there until you want to change it.
oh,
Yeah.
okay.
Yeah. That's why the lock button is very needed to be there, because sometimes like family members with children was
Right.
Kids
Yeah.
around and everything, they can like just start playing around.
So it locks in.
Yes.
Yes.
Okay.
Right. So,
That's all about it.
do you have any questions right there, or are you good?
Oh, good.
All right, folks. Thank you so much. Yeah. You can play around with it. Yeah.
You said if the CPR thing is not tight, but it won't give you a
Majority user will face. Yeah.
So this is the way to see pretty.
Yes.
This is to lock it in, this is to unlock it.
And this is the unlock, lock and unlock.
Oh,
button.
okay, okay, the same thing, okay, cool.
So the only part is just like the mute button is over here. Yeah.
Yeah,
Compared to the Domus 4. Domus 4 is all lock and mute button is all in one place. Yeah. Yeah. So let's show you over here like the cycle times.